Thank you very much for the kind invitation to participate in this webinar. I will continue with the topic of fake news, but this time regarding to the topical treatment of the varicose veins. I will not stand much in what are the varicose veins, but they are part of a manifestation of the chronic venous deficiency, and they can range from minor cosmetic concerns to significant discomfort impacting the quality of life. And they affect a very significant portion of the adult population with an estimated pool prevalence of 19%. And right now, according to the last published guidelines, there are no topical creams for the treatment of the varicose veins. These are some of the common myths the patients believe. So there is a few of them, starting from like some idea the varicose veins are just a cosmetic issue, or later think that there is a cream that can erase the varicose vein overnight, or a cream that works better than surgery, or a cream that may make the varicose veins invisible, or that prevent varicose veins forever. Maybe there is some type of cream or patch that contains a secret ingredient. Or the last one, maybe we can make our legs look youthful again thanks to a miracle cream. But the fact is, none of these myths is true. Actually, the varicose vein is not just a cosmetic issue. Varicose veins can lead to pain, swelling, itchiness, heaviness, edema, and impact the quality of life. The fact is that there is no cream that can erase the varicose veins or work better than surgery, remove the varicose veins for surgery, or prevent that. Unfortunately, there is no magical ingredient that can revert the age of our legs. Unfortunately, misinformation can lead to suboptimal treatment decisions, so we should not underestimate the impact of the fake news on varicose veins treatment, as it can misguide the treatment decisions, and individuals may opt for the ineffective or unproven treatments based on false information, or even delay the effective intervention and potentially exacerbating their symptoms. Also, time and money are often wasted on products and treatment that offer no real benefit, diverting patients from seeking evidence-based medical advice. This information also can lead to unnecessary worry about the severity of the condition or the effectiveness of the treatments, impacting the mental well-being and increasing anxiety and stress. Not only that, fake news can undermine the patient-physician relationship, leading to skepticism towards the professional medical advice and evidence-based treatments. And finally, the widespread belief in ineffective treatments can influence public health policy and risk allocation, potentially leading to broader health implications beyond individual cases. That's why in our daily practice, we need practical tools and strategies to discern credible information from misinformation, not only for us, but also for our patients. This is crucial in empowering them to make informed decisions about the effective management of varicose veins that often requires a comprehensive approach. We should always remember ourselves and our patients to consult credible sources. Really, we need to make clear that whatever information it is found in the net should be always verified with healthcare professionals, especially vascular surgeons, if we are relating this to varicose veins. As healthcare professionals, it is our duty to keep up to date and check for the last evidence that it is available. Be aware of quick fixes or miracle cures. And also, it's very important to understand the source's motive and identify whether the source of the information has a commercial interest, as information pushing for the sale of a product may not always be reliable. This is a real life example of what patients can find in the net. So basically I did what the patients do. I went to Google and I typed a search of varicose veins treatment with cream, and I got redirected to different websites, the most prominent of them Amazon, and I found diverse type of creams with a lot of variety, even veins patch with very nice descriptions. Even I found a horrendous design of elastic stockings for varicose veins, not including the ankle and the foot. All of them were promising the type of myths that we have been commenting before. But what really worried me is the fact that many of these reviews were about 4 or 5 stars, and these comments are coming from patients. Like, for example, with this product here, which has more than 1,500 reviews and 4 or 5 stars. And indeed, this is a placebo effect. There is no science behind this type of creams. That's why identifying misinformation and understanding its characteristics is really important. But there are a few keys to spot fake news in general, not only for fake news and the varicose veins. So really we should be aware of the sensational headlines, especially the news that lack of an author credibility. This news with unsupported claims and information that doesn't provide evidence from clinical studies, research, or expert testimonials, outdated information, one-sided stories. We have to take into account that legitimate health news will often present various perspectives, including potential drawbacks and side effects. And of course, all the news with promotional content, that it is aiming at selling a product or service rather than providing unbiased information. I will finish my lecture with a few take-home messages. So in this era of misinformation, it's very important to provide to our patients very clear messages. The varicose veins is a very common condition, and we are going to face this situation many times. And the patient will come, hopefully, to ask us about different type of treatments that they see in the net. So we need to explain to them that the evidence-based treatments are the key. The critical evaluation of the information, it is essential. That we are invaluable when it comes to a comprehensive approach and to provide the best treatment, not Google search of Amazon. To be able to combat all this, we really need to stay informed with reliable resources and up to date. Thank you very much for your attention.